sulfur's kind of like fluttered in and out of my consciousness over the years. But once I did this course with Dr. Janelle, she's been using high dose sulfur therapy for, if memory serves, about 25 years. And just talking about like her multitude of experience, or her wealth of experience, I should say, multitude of cases, just helping patients with chronic digestive disorders getting better using high dose sulfur therapy.
Hello and welcome. I'm so glad that we get to hang out today. We are getting to hang out with Dr. Bryan Rade again. I stinking love this guy. He is so smart, and I trust him so much that when my parents' health is too complicated for me and my little brain, I go to Dr. Bryan. He is fantastic. I trust him with my family. I trust what he says. He is so knowledgeable, and I am so thankful that he came on the show again. We had him on the show back in 2023. I can't even believe it was this long ago. We were talking about the key aspects of successful keto weight loss. And then again in November, increased energy and balancing hormones, your mitochondria. And we talked all about mitochondria in that episode. It was a really fun one. So if you enjoy our conversation with Dr. Bryan today, be sure to check out those episodes. Again, that's October 17th, 2023 and November 28th, 2023 for those episodes. Also in today's chat, I do mention my degenerative arthritis in my spine. That was an episode that launched August 27th, episode 488. If you want to learn more about my full body MRI using Pronovo, the results of that scan, how happy I was to get that full body MRI. If you just want more details, all of it is in that episode that I mentioned today. If you're not familiar with Dr. Bryan, he works with patients presenting with complex chronic illnesses, including persistent paralysis, co-infections, mold illness, integrative oncology, health challenges related to autism spectrum, pandas, neurological disorders, basically all complex things he knows about. And he is just a continuing education enthusiast. And if you go to his website, he has listed everything that he's ever learned, and it is epic. So I am just so excited that you're joining us in this enlightening episode where I wanted to go through some of the therapies that he uses in his practice that you may not have ever heard of. One of them being high dose sulfur therapy, which I have done. It's incredible. Highly, highly recommend it. Exocrine pancreatic insufficiency, which I also have. Highly recommend if you have this to listen in. How you know whether or not you have EPI is the best way I know how is to do a GI map. We've talked about GI map on the podcast a couple of months ago, June 25th, episode 479. If you want to learn more about stool testing, what that looks like, elastase, and those sorts of things. And then we talk a little bit about phospholipid therapy for brain fog, skin issues, and fatigue. Okay, let's cut over to our episode with Dr. Bryan. If you want to learn more about his practice and the things that he's doing, head on over to eastcoastnaturopathic.com. His Instagram is dr.bryanrade.nd. And I will include all of this in the show notes, including both his podcasts, which are Overcoming Chronic Illness podcast and the Optimistic Future podcast. Let's cut over to it. Hey, my name is Leanne, and I'm fascinated with helping women navigate how to eat, move, and care for their bodies. This has taken me on a journey from vegan, keto, high protein to everything in between. I'm a small-town holistic nutritionist turned 3-time international best-selling author turned functional medicine practitioner, offering telemedicine services around the globe to women looking to better their health and stop second-guessing themselves. I'm here to teach you how to wade through the wellness noise to get to the good stuff that'll help you achieve your goals. Whether you're seeking relief from chronic ailments, striving for peak performance, or simply eager to live a more vibrant life, this podcast is your go-to resource for actionable advice and inspiration. Together, we'll uncover the interconnectedness of nutrition, movement, sleep, stress management, and mindset, empowering you to make informed choices that support your unique health journey. Think of it as quality time with your bestie mixed with a little med school so you're empowered at your next doctor visit. Get ready to be challenged and encouraged while you learn about your body and how to care for it healthfully. Join me as we embrace vitality, reclaim our innate potential, and discover what it truly means to pursue healthfulness. Hey, Dr. Rade, how's it going?
I'm doing well, Leanne. How are you doing today?
I'm so good. I'm so glad that you're back on the show.
It's always a pleasure to chat with you, and I'm excited too.
Oh, you are just such a wealth of knowledge. And I always ask guests, for those listening, I always ask guests, like, what are the things that you want to talk about? What's lighting you up? And Dr. Rade gave me a whole list of things that I know very little about. So I'm excited to pick your brain and understand some of these therapies and approaches that you take to supporting your clients. You are just one of the smartest people I know. So I am just so honored that I get to have you on the show today.
You're very, very kind, Leanne. I'm happy to talk with you too.
Okay, so for those that maybe didn't listen to our first episode and kind of want the gist of what you do, why you do it, can you just tell us a little bit about yourself and why you do what you do?
Sure. Yeah. So I'm a naturopathic doctor. I practice in Bedford, Nova Scotia, which is just outside of Halifax, Nova Scotia, for folks familiar with Nova Scotia geography. And I have a clinic here called the East Coast Naturopathic Clinic. It's myself and a few other naturopathic doctor colleagues. I host naturopathic residents here as well that train with me. Yeah, I mostly focus on patients who are suffering with different types of complex chronic illnesses. So things related to, say, chronic infections like Lyme disease or co-infections, chronic viral infections, mold illness, heavy metal issues, histamine-related issues. Over the last few years, I've been seeing more and more patients with dysautonomias like POTS and orthostatic intolerance. Treat a lot of folks with neurological conditions like Alzheimer's and Parkinson's and ALS and things like that. And then I also do a lot of injection therapies. So for like sports injuries and arthritic joints, like prolotherapy and ozone and things like that. And then I also treat a lot of kids on the autism spectrum, kids with PANS and PANDAS, which are these neuroinflammatory conditions that can affect the nervous system. And then I also treat folks who are dealing with oncology concerns. So I have no social life and no spare time, and I just like to study. And no, I'm just kidding. I have a wonderful family and do manage to fit in exercise and some hobbies and things in there too. But I've been practicing for 15 years, and just if I don't know about something, I don't like that. So I just go and learn about more and more stuff, and I'm never bored.
I mean, your resume definitely confirms that, because when you look through all the training that you've had, you got to keep scrolling. You just keep on scrolling because he's done all the things. So yeah, you definitely have a good collection. What is the thing right now in your practice that you're most lit up by and that challenges you, that you're like deepening into recently? Like, is there an area where you're most excited about or where you're challenged in? Like, what's the thing right now? Is there a thing?
There's multiple things. There's always new things. And, there's things that I've been doing for years that I continue to do. Like, for example, running a joke. My sister is visiting right now from Denmark, or she just went home today. And, she's been teasing me for years. She's like, oh, I can do what you do. I just give everybody magnesium. And it's like, yeah, that's true. I mean, like almost everybody gets magnesium because it seems like almost everybody's magnesium deficient. So there's things like that have held true. Or, I think our first chat together was about mitochondrial dysfunction. And, I'm still prescribing comprehensive mitochondrial support for so many of my patients because so many folks have, low energy and brain fog and, recovery issues and things like that, like physical and recovery issues and whatnot. So there are things like that are just tried and true, that are kind of like the foundational parts of my practice. But then, I'm always, keeping my ear to the ground, learning about new things, working with new things with my patients. And some things I work with, they just don't stand the test of time. They just, didn't really work as well as I thought they would. And so we stopped using them. And then some things I'm really excited about because they're working well. So like, one of the things that we've been doing for almost a year now in our clinic is doing a quantitative EEG brain mapping and then also neurofeedback. So basically doing this objective test to measure patients' brain waves. It kind of looks like you're wearing a glorified shower cap. It's got 19 different sensors on it, and it measures measures the levels of the 5 different brain waves that we have, our delta, theta, alpha, beta, and gamma brain waves. And so basically by reading the brain waves, we get what they call a brain map. It's kind of this color-coded picture of the brain, and it gives us a lot of insight into what's happening with someone's nervous system. And I'm really kind of generalizing here because it's like, you can really geek out on this stuff and really get into the weeds, but like generally speaking, it can tell us whether someone's, kind of stuck in more of a sympathetic dominant mode, or if their parasympathetics are, overfiring or burnt out. It can tell us whether there's what's called hyperconnectivity, where there's kind of too much communication happening between different regions of the brain. And that might be leading to symptoms like anxiety or, having like excessive emotional lability. Maybe patients who are really sensitive or reactive to things, like their nervous systems are just so like heightened or keyed up that that's causing this kind of like hypersensitivity picture to come up. Or we can look at the brainwave patterns and see if there's evidence of what suggests neuroinflammation or maybe neurodegeneration happening. I've had so many patients come in where they say, I'm convinced like I must have early onset Alzheimer's or something like that, or like I've dementia runs in my family and my memory's been going off and all that. And so, well, why don't we do a brain map? So we'll do the brain map and see, well, this isn't like an MRI or like a functional MRI or, something that's it's not a brain biopsy or something like that. But for like on a functional level, it's like your brain does not look neurodegenerated. Your brain looks like it's really, really busy. You've got too many, irons in the fire. You're burning the candle at both ends. Well, you've got way too many super excitatory beta brain waves. You've got this excessive hyperconnectivity of something called abnormal beta asymmetry, and you do not have elevated delta and theta waves, which would suggest, a lot of neuroinflammation or, some, majorly serious thing going on with your brain. So like, don't think that this is, early onset dementia. I think you're just really busy and we need to, focus on settling your nervous system down. So that's where, in comes neurofeedback, this, very non-invasive method of helping to regulate the brain waves. There's different methods out there for working with neurofeedback, kind of at home things like, I think there's one called Mind Lift. There's another one, name I'm blanking on right now. It's been a busy day at work here. But there's different ones that you can kind of purchase that are just out there that you can kind of train yourself to use, or you can work with a clinic that does, clinical neurofeedback. And we can really get into some super, sort of specific protocols to say, hey, based on your brain map, you've got too much beta, not enough alpha, too much hyperconnectivity, or beta asymmetry is off kilter. Well, let's come up with a tailored neurofeedback protocol to specifically start kind of massaging those brain waves back into the, optimal pattern so that we can hopefully see, better sleep, better energy, less anxiety, better mood, better motivation, better mental clarity. Some people use neurofeedback strictly to treat pathologies that are afoot, and that's really important. That's mostly what we do. But then some people will also use it to biohack their brains to just work better. So, I drag my system home on the weekend. I'm, neurofeedbacking my kids and my wife and I, and we're just, trying to get even smarter and all that good stuff.
That's so awesome. So it sounds like this brain mapping, it's not necessarily a diagnostic tool, but perhaps a way to understand how the body is going to accept protocols. Like you mentioned, the hypersensitivity piece. And in the case of Lyme, maybe you would agree with this. Like a lot of my Lyme clients are just so sensitive to everything. And so somebody that could benefit could kind of be in that realm. Did I kind of summarize that right? And that it's not necessarily a diagnostic tool, but helps us be able to understand how the body is going to accept protocols and kind of get your body regulated to the types of protocols that you would work on. Because if your nervous system is spazzing out, they're not going to do well on a ton of antimicrobials and binders and detox. Is that right?
Yeah, that's a really good way to put it. And that word like regulation is just so key. Like, I know on my podcast, it focuses on talking with clinicians who specialize in treating complex chronic illnesses. And it's really hard to find a guest who doesn't mention nervous system dysregulation, and whether they're, recommending amygdala retraining or somatic experiencing, or now like everyone's talking about the Primal Trust program. And I think with good cause, because I've been getting positive feedback from patients about that. Or one of the folks I just interviewed recently, one of the smartest people I know. So like where it's like, oh man, like who's, I love talking to this guy because he's so brilliant. His name's Dr. Greg Nye. He's out in Washington State, and like just one of the smartest people I've ever talked to. And he was just, anyways, I was like fascinated for our 45-minute chat. Anyways, he was talking about the Safe and Sound protocol, which is, brainchild of Stephen Porges, who developed, polyvagal theory. Like he was saying like, yeah, like that's what we do in our practice. Or then, I had interviewed Dr. Javen Mure, who's from Kansas City, Missouri, who turned me on to neurofeedback in the first place through a podcast episode, that I had with him a little over a year ago. And just all these brilliant docs are talking about how important it is to regulate the nervous system. One of the things that I really like with the brain mapping is that it gives us this objective tool, this objective assessment method to see like, well, what's actually going on with your nervous system regulation? Because it's all well and good. I kind of half joke with patients all the time where, well, their favorite joke to make is like when we're going over their first report, it's like, so is there a brain in there? And it's like, yes, there's a brain in there. It's the best joke. But then, I'll say it's probably not surprising to hear that, like, you do have this sympathetic dominant picture going on. Like, you do have this hyperconnectivity. Like, yeah, like I could have told you that. It's like, yeah, you could have told you that. I could have told you that because we know this. But now we can see, well, is it the hyperconnectivity piece? Is it, the two alpha's too low? Is it a delta thing? Like what, we get all the little nuances of it, and it helps us to tailor the neurofeedback protocol. But it also gives us this piece of paper. I mean, it's all electronic nowadays, pieces of paper. Do we still use those anymore? But, it's essentially this metaphorical piece of paper that actually says, like, this is what's going on with your nervous system. It's not this hypothetical abstract thing. And when folks see that, oh, yeah, like my nervous system is like really revved up and it does not look like I'm super neuroinflamed. It does not look like I'm super neurodegenerated. I'm just really, really revved up. It's like, well, darn, like maybe I do need to try to find some work-life balance. So, maybe I do need to work on this nervous system retraining stuff. Because quite frankly, like in my practice, and I think that this is a limitation of a lot of my colleagues who specialize in complex chronic illness, a big challenge is like, it's generally speaking, notwithstanding the cost and everything, like it's not hard to get a patient to take pills. You can get a patient to take a laundry basket full of pills. And I don't advocate for that. I really try to be a supplement minimalist, but you can get a patient to take pills, like no problem. But trying to get someone to like, meditate, to do some mindfulness work, to do, nervous system regulating activities, like you might as well ask them to change their religion because that's going to be easier for most people. I'm obviously exaggerating, but it's when we have that objective test, we can see, hey, how's your nervous system doing? Okay, you really got to work on this. And then, hey, we can do a follow-up after a while. You don't have to do neurofeedback. You could go off and do the Safe and Sound protocol, go off and do some meditation, go off and try to find more, work-life balance, whatever it is. Go work with some liposomal GABA, go work with something to work on that nervous system. And then let's re-brain map you and like, hey, things are looking better. We're actually seeing some improvement. So I think that's really valuable for showing to patients, not that it applies to everybody, but in many cases, like we got to work on your nervous system. Here's an objective metric for that. And then you can actually track your progress as well, which it's been really useful for those reasons and many more.
Yes, tracking the progress is key to really anything because oftentimes we can lose the confidence in our protocols. Things are just sometimes moving at a snail's pace, or the things that we want to improve aren't improving, but other factors are improving. And it's hard to kind of like see all of that unless you have that piece of quote unquote paper to kind of see how you're progressing. So when it comes to nervous system dysregulation, before we move kind of on to your next topic and some of the other tools you use in your practice, what are some of the symptoms of a dysregulated nervous system, just to kind of hone in on individuals that maybe are hearing this conversation and they're like, do I have issues like this? Like I know for myself, how I know that my nervous system is dysregulated is that I react, like I overreact to situations, or I dwell on situations that shouldn't be overly reactant. Like I'm spazzing. I can feel tired, but unable to shut down. Like I know I need rest, but I just can't rest. Are there other signs that we should be looking for to understand whether or not our nervous system is dysregulated?
Yeah, those are definitely good signs to look out for. I mean, I would say for like the average person, like someone who's not suffering from complex chronic illness, I think probably the easiest litmus test would be, or comparison would be like, if you've been having like a really bad day, like the kids are giving you a hard time, work didn't go well, rush hour traffic, whatever. And like the way you feel in that state when you're like, I just have like, a teeny, tiny ounce of capacity left and like anything's going to push me over the edge. That would be, a person whose nervous system is now officially dysregulated. And thankfully, good night's sleep, you'll be back to baseline the next day. For folks that are dealing with more, complex health problems or whatnot, like, that could manifest as being really reactive to stuff, sensitive to supplements and foods and things like that, chemicals. And of course, there can be there's physiological explanations for that over and above nervous system dysregulation, but it can be a really significant underlying component. Like I've had patients where before they do nervous system work, like they're just reacting to, they're like, I can eat 5 foods. And it's like, oh my gosh, is it SIBO? Is it LIBO? Is it leaky gut? Is it whatever? And it's like, yeah, and sometimes it is. But then there's patients like, yeah, I've done like every gut test and treatment. And it's like, why am I still so reactive? It's like, well, it can be nervous system mediated. So reacting to things excessively can be a clue. Also, sometimes you'll start seeing some of your basic physiological functions becoming dysregulated. So kind of just thinking of, okay, what are all the things that continue to work even when you're unconscious? So like, well, you're still breathing, your heart's still beating, things like that. Like those kind of basic systems can start getting dysregulated. So I'm having shortness of breath, or I'm breathing too quickly, or my heart rate's increasing, or blood pressure fluctuations are happening, that kind of thing. Those would be some more physiological manifestations of nervous system dysregulation. Sleep related issues can be there. Anxiety, if I didn't already mention that one. Those are some of the things that could be indicators.
I want to share something that has truly transformed my daily routine and overall well-being. Timeline Nutrition's Mitopure supplement. I've been taking it for about a year now. And let me tell you, it's been a game changer. The energy boost I get is incredible. Not only do I sleep better, but I can also push harder in the gym and recover faster. It's so strong, I can only take one capsule a day. Now, here's why Mitopure is so effective. It's developed by Timeline, a Swiss-based life science company that's a global leader in urolithin research. After 10 years of development, they created Mitopure, the first product to offer a precise dose of urolithin A, a powerful postbiotic that upgrades your mitochondrial function, increases cellular energy, and improves muscle strength and endurance. Here's the best part. Timeline is offering 10% off your first order of Mitopure. Just go to timeline.com/KDP. That's TIMELINE.com/KDP for 10% off your first order. Give it a try and see the difference for yourself. Yes, and I guess an encouragement to those listening, perhaps you'll agree with me, is I've done quite a significant amount of nervous system work. Recently, I did a really stupid thing where I took a really, really high dose of GABA, like really high dose by accident. A friend was working on a supplement. He gave me a sample. He put in the wrong amount of GABA. It really messed my nervous system up. But I was surprised at how quickly my body regulated itself. Whereas a couple of years ago, had my nervous system been dysregulated like that, it would take me quite a while to like gain my footing. But all these tools that I have and just like the practices that I have, and they're not super complicated, definitely helped me kind of swing back into balance quicker. Would you agree that once you kind of get into the groove with nervous system work, that it becomes a lot easier, more effortless to kind of regulate yourself back to that balance?
Yep, 100%.
Cool. Okay, so moving on to high dose sulfur therapy. This is something that you use in your practice. I don't know anything about this. Lay it on me. What's the deal? You're using it for chronic gut conditions. Why, how, what? Tell me.
Okay, so I'm happy to chat about it. And if folks want to kind of do a deeper dive into this, the doctor that I learned about this from, her name's Kathleen Janelle. So like Kathleen with a K and Janelle, like the name Jane with an L on the end. She's done the podcast circuit. So if you look her up, you can find her. She's also written, I think, like an ebook, and she has a website and all of that. So anyway, she's the high dose sulfur guru that's out there. And I did a training course with her, and it just really blew my mind. She made a very compelling case that a lot of us are probably walking around being sulfur deficient. I mean, circling back to the ongoing funny joke with my sister, where it's like, everybody's magnesium deficient, and of course everybody's not magnesium deficient, but many people seem to be. Many people seem to benefit from taking magnesium supplementation at an appropriate dose. I really am, with each passing day in practice, I'm thinking more and more that it kind of sulfur is the new magnesium, and that I think a lot of us might be deficient, or at least in my patient population of treating a lot of folks that are chronically ill. There's a PhD researcher from MIT named Stephanie Seneff, and I've heard her lecture before. She's done the complex chronic illness conference, circuits for years. She's brilliant. She talks a lot about the negative health impacts of glyphosate, which is the active component in the pesticide Roundup. And it's actually just one of those things where, like, I've heard Dr. Seneff lecture like a number of times over the years. And she's actually, I remember her saying, like, sulfur deficiency is the nutrient deficiency nobody's ever heard of. And actually, it's funny how things are a little circular sometimes, or interconnected, where like Dr. Nye and I, like, we chatted at an oncology conference once upon a time, just like, on the side, about sulfur deficiency, and he was talking about this. Him and Dr. Seneff have co-authored papers together, and so I was like all thinking about sulfur, but then there's just no one to guide me, so to speak. Nobody really talking about sulfur supplements. You go to the supplement store, and there's every vitamin and mineral you can think of in multiple options for each one, but like there's no sulfur supplements. Sure, you get Epsom salts or something like that, but that's not for internal use as a rule, unless you want to give yourself a lot of diarrhea. And so sulfur's kind of like fluttered in and out of my consciousness over the years. But once I did this course with Dr. Janelle, she's been using high dose sulfur therapy for, memory serves, about 25 years. And just talking about like her multitude of experience, or her wealth of experience, I should say, multitude of cases, just helping patients with chronic digestive disorders getting better using high dose sulfur therapy. And of course, I don't speak for Dr. Janelle. This is just my take from, the training that I did with her. But from what I took from that and what I've been starting to see in my practice as well, having been using this with a growing number of patients, folks that they've just done everything. They've been treated for the SIBO, yeast, LIBO, parasites. They've done every diet you can think of. I have a patient right now where she's done all of those things, like every test, every treatment. She's tried to do the carnivore diet, which, say what you will about the carnivore diet, but like there's nothing that you eat on a carnivore diet that really should be able to produce gas. And yet like she's still like distended out to here. And it's like, what the heck? And so, put her on high dose sulfur protocol, and she's still building up her protocol. She's very, very sensitive to certain things. And she's like, this is like the first thing that's brought my distension down. Like we've been treating her for exocrine pancreatic insufficiency, like all these like, more like obscure things and then some. Like, when patients come to see me, they've typically done the first and second line things. And I'm like the third, fourth, fifth, and sixth line therapy guy. And like, we've done all the therapies. It's like nothing. And like finally sulfur comes along and it's moving the needle for her, which is so encouraging and exciting. So I've had a few really tough cases where we've done everything and it's finally cracking those cases, which is really exciting. As far as sulfur goes, again, you don't go to the supplement store and see the sulfur section. And if anybody cares to think back to chemistry class, sulfur, it's like that stinky yellow, gross smelling, probably gross tasting stuff. Thankfully, for better or for worse, that's not available as a supplement. Nobody would probably want to take it. The way folks take high dose sulfur is by taking the supplement MSM. MSM, folks who aren't familiar with it, stands for methyl sulfonylmethane. And methyl sulfonylmethane, it's a really simple molecule. If you care to, Google it or whatnot, which nobody will, but I have, it's basically a sulfur atom. It's got 2 double bonded oxygens to it, and then 2 methane groups, carbon with 3 hydrogens attached, 2 of those. So it's actually quite a small molecule. So by weight, it's actually quite dense in sulfur. So when you take MSM as a supplement, you're actually getting quite a bit of sulfur by weight. And so that's what Dr. Janelle has used for 25 years to get her folks on sulfur. So that's what I've been doing as well now. And it's just something that's been really making a significant difference for a number of folks dealing with digestive issues. It has antibacterial properties, anti-yeast properties. I have one patient who started taking MSM, nothing else, and she passed parasites, which is like, well, that's interesting. I looked into it. It's like, yeah, it turns out sulfur is like an old-timey treatment that used to be used in conventional medicine to treat parasites before they had all these other pharmaceutical drugs available. It's something that's really important for tissue healing. So my understanding is that a significant part of why it can be so helpful in these chronic digestive cases is because it's actually helping to heal the gut. If we're sulfur deficient and our intestines can't heal properly, well, then it may be that, say, the leaky gut that was caused by the SIBO or the yeast or the food sensitivities or whatnot is just has never actually healed up properly. So we're taking the sulfur to help actually heal up the gut so it can truly repair. Sulfur is also really important for our sulfation detoxification pathways in our liver. It's really important for our mitochondrial function. And I'm a mitochondriac very proudly, a mitochondriac, obsessed with mitochondria. They're the most crucial thing for, our health promotion and maintenance and all of that. Resolving disease is all about, treating the mitochondria in almost every case. Sulfur is incredibly important for the structural components of the mitochondria. So even me is like, we spoke about, comprehensively treating the mitochondria last time. Well, I didn't have any sulfur in that protocol. It's again, just no sulfur supplements, but I have some patients now who've started with the MSM protocol, and it's actually boosting up their energy levels, which is really exciting. And then sulfur is also really important for our connective tissue. So ligaments and tendons and other structures within our joints. So when people take, say, glucosamine sulfate or chondroitin sulfate in a joint support formula, and oftentimes there's MSM in there too, then that's something that's indicative of how important sulfur is for the health and integrity of our joints. So with Dr. Janelle, when I had the opportunity to train with her or study her material, she was asking her, I'm like, well, what about this? What about this? What about this? And she's like, I'm not speaking for her, but just my take home from her response was that, she mostly treats digestive issues. Yes, she's treated patients with mold illness and different conditions too, but she was like, yeah, those are really good questions. And like, it's just not an area that, to my understanding, she's specifically forays into a whole lot. So I've been, kind of seeing, well, what kind of results can I see with my patients who are dealing with different complex chronic health issues outside of the digestive realm? And, I've been seeing some really encouraging results. So I'm, really excited about it.
That's really cool. You're actually blowing my mind right now and connecting two dots that I wasn't really sure were connected, because I did an MRI scan, a whole body MRI scan just a little bit ago. And it came back with degenerative arthritis in my spine. And this is like not something that I thought that I had, but kind of looking at where it is and where I experience pain, my chiropractor recommended MSM. So I started taking MSM, and I'm taking a pretty good amount of it daily, about 10 grams, which maybe that's not as high dose as what you do. But I have noticed my digestive system is like crazy good. Like I'm not as bloated. And I just thought maybe I just didn't put two and two together until you said this. I'm like, okay, yes, that's exactly within probably a week or two of starting the MSM. My bloating has significantly decreased. Like usually by the end of the day, I have a little bit of a belly, but I haven't the last couple of months taking this. So very cool. That is really cool.
Very cool. That's great.
So how do you test? Are you testing for the sulfur deficiency, or are you just assuming based on a collection of different symptoms and issues that one would have a sulfur deficiency?
Yeah, that's a great question. That was my question for Dr. Janelle during her course. And yeah, unfortunately, there's no test for sulfur levels. There's at least one lab out there, probably a couple of labs, I think, that do like these kind of micronutrient blood tests that are available. And I believe that at least one of them has sulfur on the panel. But it's one of those things when it comes to lab testing for nutrients, it's like, well, sure, we can test the blood levels like in this moment, but then how are they going to look later in the day? Are those levels actually indicative of tissue levels at all? My favorite example is, you measure go back to magnesium again here. All right, but we'll use calcium instead. We'll leave magnesium alone for a little bit. Oh, like I'm looking at my blood calcium levels. Oh, my blood calcium levels look good. I guess I must not have osteoporosis. I guess my bones must be fine. It's like, nope. If your calcium levels in your blood go off kilter, you die pretty quickly. So the body keeps it super stabilized. Even if you're the most osteoporotic person on the planet, your blood calcium levels are probably going to look amazing. So blood sulfur levels, there's no evidence to suggest that indicates whether you're sulfur deficient. So we're really just kind of we just have to try it, see if it makes sense clinically and then see how you feel. One of the things that I am reassured by, because it's like, whenever it's like high dose something, it's like, well, we always wanted to put patient safety above all other things. I mean, like I'll experiment on me with just about anything, but like, am I going to prescribe something to a patient, And they've done toxicity studies on MSM, and like, even at dosages that are markedly higher than like the high dose sulfur therapy that Dr. Janelle teaches about, it's like really, really safe. Like it's very hard to become toxic on MSM. I can't say it's impossible. I'm sure if you like jumped in a vat of it, you could drown in it, I suppose that would be toxic, but on a chemical level, like it's not non-toxic.
That is so interesting. So the next kind of therapy that you use, or maybe just an approach that you're thinking of when you're working through some of the digestive disorders, is the Exocrine pancreatic insufficiency. Can you tell us a little bit more about what you're seeing there?
So with EPI, it's something that, I'd learned about in naturopathic school once upon a time. And when you look at a medical textbook, it's like basically EPI is going to be caused by essentially one of three things. It's either chronic pancreatitis, where your pancreas has just been inflamed for a long time and it's kind of gradually become destroyed over time. So you don't have much exocrine pancreas left. Just take a quick step back, what is exocrine pancreatic insufficiency? So your pancreas is broken up into two sections, your exocrine and endocrine components. Approximately 90% of the pancreas is exocrine, which makes your digestive enzymes. And the other 10% is the endocrine component, which makes insulin and glucagon and somatostatin, so like the hormonal components of the pancreas. And so when we're talking about exocrine pancreatic insufficiency, it's talking about the exocrine part of the pancreas, so the enzyme part. And then it's an insufficiency, so not enough of that. So basically not enough enzymes. So like, why don't they just call it, not enough enzyme disease? But of course, it has to sound fancier than that if it's medical. So there's basically three known, in the medical textbooks, there's three causes of that essentially. One is chronic pancreatitis. So my pancreas has been inflamed and cranky for years and years, and it's just gradually broken down. Another is pancreatic cancer, where there's either a blockage or there's been destruction of the pancreas. And that person has bigger problems than enzyme insufficiency, to say the least. And then there's also cystic fibrosis, which is characterized by lung issues and pancreatic enzyme issues. And basically that's kind of the list. So it's basically just really serious stuff. And it's so for kind of the average person, who's say, not to downplay, sort of other conditions, but if you're quote unquote, like, just experiencing, indigestion, gas and bloating and constipation, diarrhea, whatever, it's like, well, you're not going to have cystic fibrosis and chronic pancreatitis on your differential diagnosis list as a rule. So exocrine pancreatic insufficiency was just never really on my radar, but I did this wonderful course, again, studying, learning new things all the time. It's actually all about SIBO. And, even though I've been treating SIBO for, 10 plus years now, I've literally teach a training course on it for other clinicians. I'm always keeping my ear to the ground, like to learn from other folks as well. So there's this really brilliant doc. His name's Dr. Kangura. He's out in British Columbia. And so he taught this really great course that I took, and it was all about a SIBO update. And then he also had a section on exocrine pancreatic insufficiency. And he was, and I don't speak for Dr. Kangura either, but he was talking about how in his practice, if I'm hopefully summarizing this well, that he has a lot of patients with EPI that's, not related to those more severe pathologies. And so there's this simple test that can be done. It's called a fecal elastase test. Elastase is this enzyme that's produced by the pancreas, and it's an enzyme that doesn't get used up or broken down easily in the digestive tract. So it's an enzyme that they basically determine that if you test it in the stool, it's a very good indicator of how well the pancreas is working. And so basically the fecal elastase level should be above a certain cutoff point, depends on, the lab that's used and your clinician's experience or, opinion and all that. But generally the cutoff we use in our clinic is that the level should be ideally above 500, but at the very least above 200. If the level is less than 200, that's generally considered to be EPI. And so we do these tests at the clinic called a comprehensive stool analysis. We've done these for years. And so, I did this lecture with Dr. Kangura and listened to his course or whatnot. And then it's like, okay, well, I'll go, because they test elastase on the comprehensive stool analysis. So I went back and checked a bunch of patient results. I'm like, oh yeah, like that patient, like, yeah, we've got pretty good results, but like they're stuck on their limited diet, or they seem to keep needing to take their stomach acid for years on end or whatever, like, cases that are better, but not, fully resolved to the extent that I'd like them to be. And it's like, oh my gosh, like all these people have low elastase. And on the labs, they say, they should be, the lab we use anyway says, well, it should be greater than 200. And so anything that was above 200, I just never thought twice about it. And of course, I'm not thinking about EPI because none of these patients had pancreatic cancer or cystic fibrosis or whatnot. So anyways, started using some high-dose pancreatic enzymes with these patients, and a whole bunch of them started getting better. We started seeing like notable symptom improvements, and some of them to the point where they improved, their symptoms were good to go, like their symptoms had resolved rather, and then they're like, I can eat more foods and my gut seems to be healing, and like it just seemed to be the missing piece of the puzzle. And so I always like to try to have some framework as to why things are working. It's like, well, geez, and then even a couple of patients where we just could not get their SIBO resolved. We get their symptoms improved, they're like stuck on herbs, they're doing, this, that, and the other thing to try to, maintain their, level of symptom improvement. They go on enzymes, and then we retest and we see like the SIBO is gone. It's like, what's going on? Like, that's amazing, but like, why is this happening? And so my best theory as to why that's happening is that if the issue is that, okay, they're just not digesting their food properly, so they're feeling better because we're kind of culling the microbes in their gut, but then they're not digesting their food properly, then there's still this steady stream of food, of just not properly digested food getting to the critters in the gut. And then that's just perpetuating this SIBO. So it's kind of like we've gone from full-blown terrible SIBO to more of like a low-grade chronic SIBO. Well, then we get the enzymes in there. Now they're digesting the heck out of that food. They're feeling better. The microbes are finally getting starved out properly. And then they get down to a normal, healthy level. And then the gut can actually heal and they're off to the races. So with the exocrine pancreatic insufficiency, it was another big aha moment, so to speak, where it's like, this cracked a bunch of cases. And then now I have, a number of patients where, okay, we found the SIBO, we maybe do a stool test as well. And it's like, well, while we're waiting for the oregano oil or the berberine, or maybe they're going to get some rifaximin or whatever it is, like, well, in a number of cases, I'm putting them on the higher doses of pancreatic enzymes as well to help, mitigate symptoms faster. And I think, get rid of the SIBO faster because of the starving out mechanism.
Yes, I see that in my practice too, because load elastase will cause the commensal to be high And commensal bacteria like Enterococcus, Lactobacillus, Clostridium, their job is to keep the opportunistic in check. And so if they're elevated and then the opportunistic gets out of whack, then you're going to be dealing with things like Pseudomonas and strep. And so it's like this digestive dysfunction issue, which a lot of practitioners will just say, let's do the antimicrobials, but we'll totally avoid looking at the elastase. And so, yeah, I totally see that in my practice too. When it comes to addressing EPI, you said high dose pancreatic enzymes. What are your favorites? What's high dose? Because a lot of people just think digestive enzyme, just a little bitty and it'll be fine. But what are we talking about here?
Yeah, so that's been a little bit of a journey as well, because what I took from Dr. Kangura's course is that, in these cases, so I practice in Nova Scotia as a naturopathic doctor. Unfortunately, we don't yet have the ability to access pharmaceutical drugs for our patients here. It's just not in our scope of practice. So we can, do IVs and do these injections and things, but just powers that be have dictated. We don't have prescribing authority here, unfortunately. Out in British Columbia, where he practices, they do have prescribing authority as naturopathic doctors, because the way it works in Canada, at least, is, well, I think in the States too, it's, kind of regulated province by province or state by state for the scope of practice. And so he says, what I took from his course at least was like, well, you're going to have to use like prescription grade enzymes, because like so codozyme and creon being the main ones that are available, getting these from a compounding pharmacy or some other place. So I was like, okay, well, if that's what needs to be done, he's the guy I'm learning from, like, sounds good. And so unfortunately here in Nova Scotia, it's quite challenging for patients to get access to pharmaceutical drugs that are not run of the mill, shall we say. So it was challenging for my patients to get these. So I said, well, what is creon? What is codozyme? Well, it's pancreatin. It's basically desiccated, so dried out pancreas extract from pigs. That's what it is. Just like how people take desiccated thyroid or armor thyroid, it's just basically desiccated or dried out pig thyroid gland with the active components still preserved in there. With codozyme and creon, they do come in these, basically they're micronized. So like kind of like in these little tiny like micronized cereals. So these like little tiny fat globules to help optimize absorption basically, or utilization or permeation of the food. But it's like, well, it's all pancreatin anyways. So we started playing around with pancreatin extract. And I had a number of patients where they were like, this is working really well. So I'm like, okay, that's good. And then I had patients where, say they got their codozyme prescription, but then couldn't get a refill. They switched to pancreatin. It's like, oh, that's working just as well. Some who actually found the pancreatin worked better. And I have had, I think, 2 or 3 patients to date where the prescriptions definitely work better than the pancreatin. So I'm not saying that pancreatin's like an absolute replacement for these, but what I found in my practice, and then there's some other docs, actually, there's another podcast, just to plug them, because I think they're really great. It's the silliest name for a podcast. They're called the Turd Nerds. Yeah, it's great. So there are 2 naturopathic doctors and a medical doctor. I can't remember their names off the top of my head, but I know the medical doctor, Amy Kapadia, because we've talked before. And but anyways, they had an episode all about enzymes. They're talking about this. And again, I'm not speaking for them either, but they seem to be conveying that the take-home message I got was that there can be a lot of pancreatin can work really well. Then I also, in one of my podcast interviews for my Overcoming Chronic Illness podcast, I interviewed Dr. Isabella Wentz. She's a pharmacist, I think a PhD pharmacist, if memory serves. And I was asking her about it and just saying, like, what's the difference that you see between like pancreatin and creon and codozyme? And again, I'm not speaking for her either, but seemed to indicate that like there's not really a big difference. You can't patent pancreatin, but you can patent codozyme and creon. So anyways, there's that. So as far as the pancreatin goes, what I recommend for my patients, I'm certainly not giving any advice to any of your listeners. Talk to your own healthcare provider to get advice. But we use Pancreatin 8X, and we have a company that we use. They're based out of Dartmouth, Nova Scotia, called Signature Supplements. I have no financial affiliation with them. They make this 500 milligram Pancreatin 8X, and it just it packs a wallop. It's like 100,000 USPs of protease and amylase. I think it's 10,000 USPs or something like that of lipase. It's very similar to company Thorne. They make a product called Dipan 9. It's basically the same. It just has a bit more lipase in it. So for my patients in the US, it's like, oh, you can just get Thorne easily. Up here in Canada, it's a little bit harder to get. Signature Supplements is just less expensive. But yeah, we're working with that product. And then, depending on the patient, they need, X number of capsules per meal. But it's, that's what I mean by high dose.
I love the creativity. That's really what it comes down to, of like getting to the basics. What is this thing and how can we make it work with the resources that we have? And I appreciate that so much. And I know Canadians do too, because that is an ongoing struggle, especially in Canada, is having to get very creative with the accessibility of things. So well done.
Thank you.
Electrolytes facilitate hundreds of functions in the body, including the conduction of nerve impulses, hormonal regulation, nutrient absorption, and fluid balance. Nearly every one of my clients that I work with one-on-one have an imbalance of electrolytes in some way, from symptoms of headaches, muscle cramps, fatigue, sleeplessness, or seen right there in their blood work. Much of this is improved with proper electrolyte supplementation. I consume at least one packet of electrolytes daily, and not just any electrolyte, Element, because it doesn't have sugar, fillers, coloring, artificial anything, and has the effective electrolyte ratio that so many other brands do not do right. 1,000 milligrams of sodium, 200 milligrams of potassium, 60 milligrams of magnesium. Right now, Element is offering my listeners a free sample pack with any Element purchase. Be sure to try the new Element Sparkling, a bold 16-ounce can of sparkling electrolyte water. It's my favorite right now. Get yours at drinklmnt.com/KDP. This deal is only available through my link. All orders made come with a no questions asked refund policy. Try it totally risk-free. And if you don't like it, they will give you your money back, no questions asked. Go to drinklmnt.com/KDP for your free sample pack with any order. The last piece that I want to kind of touch on, because brain fog is such a big issue, fatigue, is the phospholipid therapy that you're doing. Can you tell us more about what that is and how you're using it?
This chat is really making me appreciate my podcast that much more, because I had this other interview with someone, a nutritionist from Alberta, which is where you hail from.
Yes, it is. Born and raised.
So many good things, good people coming out of Alberta. So her name's Justine Stenger, and she works out of this amazing clinic called the Hoffman Center, and Bruce Hoffman being the medical doctor that runs that. And he was generous enough to be on my podcast as well. I've just talked to everybody. I know everybody.
That's awesome.
Just kidding, but it's really great. You know, it's been a wonderful networking opportunity. I've talked to a lot of great docs. So my understanding is that they use a lot of, well, not even my understanding. They said it on the podcast. They use a lot of phospholipids. And with phospholipids, I've known for years how critically important they are for human physiology. But what I did not know is that the manufacturing process for phospholipids really varies. So my understanding of it now is that some phospholipids are extracted in a very delicate way, so that you wind up with basically a 99% pure phospholipid extract, like so phosphatidylcholine, phosphatidylserine, phosphatidylinositol, etc. And then there's other more crude extract methods that are only going to leave you with about 10% phospholipids intact. So the analogy I've been using with my patients, I'm a big fan of analogies, is that if you had a box of fine china and you wanted to bring it, from point A to point B, like, you bring it across your living room. Well, if you pick it up carefully, bring it across the living room, place it down carefully, you open it up, all that china is going to be intact. Whereas if you take that box of china and you drop kick it across your living room, you open up the box, all the china is still in there, but most of it is going to be broken. You might have a couple of teacups that are still good to go, but you're going to have a lot of broken plates and whatnot. So in a similar vein, if you are extracting phospholipids really carefully, you're going to wind up with a lot of intact phospholipids. Otherwise, you're not going to have much intact phospholipid left, even though it's still all in there. So the reason I use that analogy is that if you look at, go to the health food store, supplement store, and you look at different phospholipids, you'll see they all just say the same thing on the side of the bottle. It's like, 1 teaspoon or 1 capsule is like 1,300 milligrams or 420 milligrams or whatever it is of phospholipids, of, phosphatidylcholine is what's usually standardized to. And so when I first started learning about phospholipids, I thought, well, let's just use the least expensive ones, because why pay, double or triple or quadruple if it's the exact same thing on the bottle? I'd ask the companies about it from time to time. They'd be like, oh, I don't know. Like this, I never got a good answer as to why like theirs was so special. And so I was like, okay, let's just use, the less expensive option. And I found that they never really worked. But after talking to Justine, like they work once in a while, but not as often as they should have, given how important they are for the body. So after talking to Justine, she was talking about the product line that she uses. It's called Body Bio. That's the one that we've been using, but there's other companies out there that also make high quality phospholipids, like Research Nutritionals and Seeking Health. And can't remember off the top of my head. Anyways, I'm not affiliated with any of them, but long and short of it is that she explained this to me. I was like, okay, I'm going to give these another shot. And like, lo and behold, I'm not saying it's a panacea for everyone, but I've seen, fairly consistently good results in well-selected patients. So yeah, folks with brain fog, signs of mitochondrial dysfunction, skin issues, like for itchy skin or like chronically dry skin. I've seen some really great results with that. Folks who seem to have a lot of like hepatic congestion where they're just not detoxifying properly. It looks like their phase 2.5 detox pathways are kind of gummed up. Like that seems to be helpful in that case. Like, and again, phospholipids, crucially important. They make up the majority of our cell membranes of every cell in the body. So, I want to make a new cell. I don't have enough phospholipids. Well, I guess I'm stuck with old cells. Mitochondria, inner and outer mitochondrial membranes, mostly made up of phospholipids. I want my mitochondria to be as healthy as possible. I need those phospholipids. Bile, most significant component in there, or one of the most significant components, are the phospholipids. I want to flush my processed toxins out of my liver. I need bile. Well, without adequate phospholipids, you're going to have, runny bile that just doesn't work as well. So it's crucially important for so many different tissues in the body. So I've been on the phospholipid train now, and I've just never looked back now that I've, learned the inside scoop of how they work and how to find a good product.
Yes, it's so key. I personally use the Body Bio, and I really, really like that brand. I like what they stand for. I'm also not paid to say that, but I do find myself using it time and time again in protocols, as well as the brand that I use for myself. And so, yeah, I couldn't agree with you more. Okay, so you've mentioned your podcast a whole bunch, and I want to understand because you have two, as if you're not busy enough. I don't even know how you do it all. You're probably a superhuman, or maybe you have a twin that you're not telling us about and you divide and conquer. I'm not totally sure, but you have two podcasts. One is Overcoming Chronic Illness and the other is Optimistic Future. Can you tell us the difference between the two and, who they're each for?
Absolutely, yeah. So Overcoming Chronic Illness, talking about overcoming chronic illness, really. It's all in the name, so folks have complex chronic illnesses, chronic fatigue syndrome, autoimmune conditions, Lyme disease, mold toxicity, histamine issues, heavy metal issues, et cetera, et cetera. That is the podcast for them. I interview experts in those areas from mostly around North America. I've talked to people from other parts of the world too, but it just hasn't come up yet. But that's what that podcast is. It's on all the major podcast platforms, and I also have on my YouTube channel, there's the video versions if folks want to see us talking in real time. And then my other podcast is the Optimistic Future podcast, and that's more of my kind of side project podcast where basically, we can all attest to the fact that there's a lot of challenges in the world, environmental challenges, social challenges, political challenges, et cetera. And it can be really overwhelming when we stop to think about all the challenges in the world to the point where it's just, tempting to like turtle or ostrich, stick the head in the sand and like just be like, I just want everything to go away. So the purpose of the Optimistic Future podcast is to interview different experts in different areas and talk about some of these issues, but then always have tangible, simple steps that we can all take to make a difference. So for example, I interviewed someone about, food waste, because that's a big impact. That has a big impact on our society, and just like simple tips that like cost you nothing, just things to think about like, talking about like best before dates and different strategies to like not waste food. Or I had interviewed someone about the fact that like major chocolate companies basically exploit their workers, to my understanding. And there are, just tips on how you can like know what chocolate to buy so that you're not, supporting those companies, support the companies that buy it from, more ethical sources, for example. Or I'll be interviewing someone soon about just like simple tips for the importance of saving water, because water is a very precious resource. So it's the whole goal is to leave us empowered that like our individual actions can make a really big difference. It doesn't have to cost any money. You don't have to go start up a not-for-profit organization. You don't have to hold a placard in the streets. You don't even have to write your, politicians. It's just simple stuff that we can all do day to day to make the world a better place, because collectively we can do anything as a species, and, good things and bad things. So we can all do good things. That's the whole point, to leave us feeling empowered and inspired.
That's amazing and very optimistic, which makes sense in the title for sure. Okay, so your two podcasts, and then what's your website? How can people interact with you on a day-to-day basis? I know you have Instagram, which is such a valuable resource. What else you got in ways that people can connect with you?
So if folks are interested in working with me, easiest way to do that is through our website, which is eastcoastnaturopathic.com. My Instagram handle is dr.bryanrade.nd. My YouTube channel, I don't know what it's Halifax Naturopathic Doctor, I think, but you just YouTube my name and find the channel there. And if folks do, and I do have a newsletter as well. So if you find me anywhere on social media, every post that I have, there's a little link or, link tree in the bio of Instagram because they don't allow links. Silly, but anyways, where you can sign up for my newsletter. And if you do that, then you get access to the first 2 modules of my Overcoming Chronic Illness course, which is basically a course to help folks navigate the waters of complex chronic illness. So there's modules on mold and histamine intolerance and digestive issues and mitochondrial dysfunction and things like that. So you can get the first 2 modules at no charge. And those are the things that are out there.
Thanks so much for coming on the show again, Dr. Rade. I really enjoyed learning from you and just hearing what you're up to. It's so great. Thanks for coming on.
Always a pleasure, Leanne. Thanks for having me.
Such an illuminating episode. I hope you got something from today's conversation. I'm sure you did because we covered a lot. Again, if you want to connect with Dr. Bryan, the best way probably is his Instagram. He posts a bunch of really, really interesting content over there. You can go to dr.bryanrade.nd, and then both his podcasts include Overcoming Chronic Illness and then Optimistic Future Podcast. I will include all the links in today's show notes, and I hope to see you back here next week for another episode. Bye.
Thanks for listening to the Healthful Pursuit Podcast. Join us next Tuesday for another episode of the show. If you're looking for free resources, there are a couple of places you can go. The first to my blog, healthfulpursuit.com, where you're going to find loads of recipes. The second is a free parasite protocol that I've put together for you that outlines symptoms, testing, and resources to determine whether or not you have a parasite, plus a full protocol to follow to eradicate them from your life if you need to. That's available at healthfulpursuit.com/parasites. And last but certainly not least, a full list of blood work markers to ask your doctor for so that you can get a full picture of your health. You can grab that free resource by going to healthfulpursuit.com/labs. The Healthful Pursuit Podcast, including show notes and links, provides information in respect to healthy living, recipes, nutrition, and diet, and is intended for informational purposes only. The information provided is not a substitute for medical advice, diagnosis, or treatment, nor is it to be construed as such. We cannot guarantee that the information provided on the Healthful Pursuit Podcast reflects the most up-to-date medical research. Information is provided without any representation or warranties of any kind. Please consult a qualified health practitioner with any questions you may have regarding your health and nutrition program.